Lower back pain is common among athletes and those involved in weight training. Weightlifters and gym goers can experience lower back pain during squats, lunges, clean and press, deadlifts, and bench press. It's something I struggled with for years. It's frustrating, painful, and demoralizing. I fixed my lower back pain and I will show you how to do the same. Hello, this is Nuruddin. In this video, I will show you step by step how to get rid of lower back pain so you can lift and work out without pain in your lower back. For reference, here is a timestamp of this video. This is a two-part video. In this explainer video, you will learn everything you need to know about lower back pain, what causes it, why it happens, and the fastest way to fix it. The second video is a 5 to 10 minute treatment video where I show you step-by-step exercises to treat and get rid of lower back pain. Before we begin, a quick medical disclaimer. I'm a personal trainer, nutritionist, physique athlete, and wellness coach. I've been lifting for 10 years. I transformed my body, but in the process, I experienced and struggled with several weightlifting injuries, including muscle injury pain and tendonitis. I was frustrated and fed up with the generic advice I was receiving from professionals I consulted with, such as ice and rest it, painkillers, and physical therapy. So I set out to solve this issue for myself. What I discovered worked so well for me, I've synthesized everything I've learned in over 5 years of research on this topic, and that's what I will be sharing with you. So this video is for informational purposes only. It is not medical advice. Lower back pain can be a sign of a serious medical condition. It's always a good idea to consult with your doctor to make sure there is no structural damage to the spine and lower back. With that said, let's begin. What causes lower back pain when lifting weights? The root causes of lower back pain are muscle restriction, subluxation, and chronic inflammation. Muscle restriction. When you lift weights and perform exercises that target or involve the lower back, the spinal erectors, glutes, hip flexors, and hamstrings contract, become stiff and tight, and after some time, lose their elasticity. Muscle restriction occurs when inelastic muscle fibers become shortened and unable to release and lengthen back to their normal relaxed state. In the case of lower back pain, lifting a weight that is too heavy or using bad weightlifting form overstretch and cause the muscles in the lower back, glutes, hips, and hamstrings to become restricted. This is usually the trigger that initiates lower back pain. When the spinal erectors become restricted, the glutes, hamstrings, and hip flexors tighten up to protect the lower back from further injury. This collective group of muscles pull and put tension on the pelvis, sacrum, and lumbar vertebrae. As a result, it causes pain in the lower back. Over time, this can affect the health of the lumbar vertebrae and spinal disc and cause a condition known as subluxation. Subluxation. Restricted muscles pull tighter on the joints. Over time, this causes the joints to move out of their normal position. This condition is known as subluxation, and it can affect the joints and nervous system in the body. In the case of lower back pain, restricted muscles in the lower back pull on the vertebrae in the lumbar spine. Over time, this causes the vertebrae to move out of their normal position, which can cause pain. Misaligned vertebrae in the lower back also stretch and choke the nerves, leading to sharp nerve pain in the lower back and shooting pain down the leg. Finally, misaligned vertebrae inflame the spinal disc in the lower back, which can lead to a herniated disc. Disc herniation in the lumbar spine creates excessive inflammation that leads to more pain. When the muscle strain and acute injury in the lower back continues for 3 months, it becomes a chronic inflammatory condition or chronic lower back pain. Chronic inflammation. So far, we've discussed how muscle restriction and subluxation cause inflammation of muscles, vertebrae, and spinal disc in the lower back. When the injury first occurs, the inflammation is acute, meaning the pain and condition are temporary. With time, the body heals injured muscles, tendons, and ligaments in the lower back and the pain goes away. However, when restricted muscles and subluxation in the lower back cannot heal and recover, and the pain continues for 3 months or more, it becomes a chronic inflammatory condition. Chronic inflammation is a state where the inflammatory process that enables the body to heal injured muscle, tendon, and ligaments is not working, and the body is no longer able to heal on its own. In this case, it leads to chronic lower back pain. Left untreated, chronic inflammation in the lumbar spine becomes degenerative and leads to irreversible deterioration of the spine. To summarize, the causes of lower back pain when lifting weights or during exercise are: 1. Muscle pain caused by tense and restricted lower back and glute muscles. 2. Subluxation caused by tight muscles that pull on the lumbar vertebrae, moving them out of their normal position. 3. Inflammatory pain caused by strain and inflammation of muscles, spinal disc, and vertebrae in the lower back. Acute versus chronic lower back pain and how to fix it. There are 2 types of lower back pain conditions: acute lower back pain and chronic lower back pain. Acute lower back pain is sharp and sudden pain that restricts movement and mobility in the lower back. It is caused by a combination of muscle restriction and subluxation. Here's what happens. Chronically restricted muscles, including the spinal erector, QL, psoas, gluteus medius and minimus, and hamstrings, are overstretched. As a result, they pull on the lumbar vertebrae and pelvis, leading to sharp and sudden pain in the lower back. When a lower back injury first occurs, most people experience this type of acute pain. If you have acute pain, you might have difficulty and pain in the lower back when bending over, sitting down, getting up from a chair, getting out of bed, walking, or simply lying in bed. Alternatively, chronic lower back pain is a dull and ongoing muscle strain in the lower back, mostly felt near the SI joint and pelvis area. When the body is unable to heal the initial lower back injury and the injury persists, it leads to chronic lower back pain. Chronic lower back pain can affect a person's mobility. In some situations, the dull pain felt in the lower back can last for weeks, months, or years. Left untreated, chronic lower back pain can trigger a relapse of acute pain in the lower back. To fix chronic lower back pain, we need to do 3 things. 1. Release restricted muscles in the lower back to improve muscle pliability. If a person experiences chronic and dull pain in the lower back, this will provide relief and help fix it. 2. Strengthen the lower back muscles to stabilize the lower back and prevent relapse. 3. Supplement with magnesium to replenish muscle magnesium levels in the body. Magnesium helps muscles relax. When the body is magnesium deficient, muscles become tight and stay tight. Likewise, to fix acute lower back pain, we need to do 3 things. 1. Reduce chronic inflammation to heal muscle strain, inflame tendons and ligaments causing pain in the lower back. 2. Fix subluxation in the lumbar spine to correct misaligned vertebrae and release pressure on the spinal disc and nerves. If a person experiences sharp and sudden pain in the lower back, this will help fix it. 3. Release restricted lower back muscles and strengthen the lower back. As I mentioned earlier, this will improve muscle pliability. Additionally, this step will also strengthen and stabilize the lower back to prevent relapse. Lower back pain can be complicated, especially if it's chronic and has been going on for years. However, implementing the aforementioned can eliminate or significantly reduce pain, improve mobility, and provide ongoing relief for lower back pain. I cover how to reduce chronic inflammation using a plant-based diet and magnesium therapy in the TitaniumPhysique Step 1 and Step 3 videos. So in the rest of this video, I'll focus on how to release restricted muscles that cause lower back pain. I will also discuss the best way to fix subluxation in the lumbar spine. First, we'll discuss getting professional help for acute lower back pain. Then second, we will talk about what you can do at home to fix fix and alleviate chronic lower back pain. Getting professional help for acute lower back pain. If the lower back pain is acute, meaning it causes sharp and sudden pain that restrict mobility, there are several things you can do to fix the condition, recover faster, and prevent the injury from becoming a chronic lower back condition. The first thing to do is find a chiropractor to adjust and correct subluxation in the lumbar spine. You can find a local chiropractor in your area by searching on your favorite search engine. I prefer Gonstead chiropractors. I like their approach to spine health, and I've had great results with my lower back. From my experience with Gonstead chiropractors, first, they do an x-ray of your spine. Next, they use a special tool to read the nerve endings along the spine to find subluxation. Then they adjust that specific vertebra. Whichever chiropractor you choose, I suggest the type that would first do an x-ray of your spine if possible before any adjustments. In my experience, this initial analysis can help prevent further complications. Most people will need 2 to 3 chiropractic adjustments to correct and fix a lumbar subluxation, but this depends on your specific situation. The chiropractor can help you determine how often you will need to get adjusted based on their assessment. Tip number 2, walk for 10 minutes after getting your lower back adjusted. This helps train the vertebra to stay in place instead of shifting back to the position causing pain. Tip number 3, get decompression for the lower back if possible. Subluxation in the lower back can lead to a herniated disc. 90% of lower back disc herniation happens in the L4 through L5 and S1 vertebra in the sacrum. Decompression can help relieve herniated disc. I personally experienced spinal decompression during my acute lower back pain treatment, and it was very effective. Ideally, spinal decompression should be done as soon as possible, as disc herniation can cause irreversible bone spurs and degeneration of the lumbar spine. Some chiropractors, including Gonstead chiropractors, provide decompression services. However, in my research, this service is limited, so you may have to look around. Tip number 4, get a massage therapist to do some deep tissue work on your lower back, glutes, hip flexors, and hamstrings. Whether acute or chronic, most people with a lower back condition experience pain near the pelvic bone and lumbar spine. This area is known as the SI joint, and it's where the lumbar spine, sacrum, and pelvic bone come together. When muscles in the lower back, glutes, and hip flexors get restricted, it pulls and puts tension on the SI joints. As a result, it decreases the elasticity of the tendons and ligaments that attach the lumbar, sacrum, and pelvic bone. Lack of elasticity in the glutes, hip flexors, hamstrings, and lower back erectors is what produces pain in the SI joints. So find a massage therapist, ideally someone who works with athletes and weightlifters. In my experience, they tend to have a deeper understanding and knowledge of this condition. Ask the therapist to work on the spinal erectors, quadratus lumborum, also known as the QL, psoas, gluteus medius and minimus, and the inner hamstring muscles. In my experience, you may have to try 2 to 3 different therapists to find a good one. Once the sharp and sudden pain in the lower back is gone and you can move freely without acute lower back pain, you can begin implementing specific exercises and techniques at home to strengthen, stabilize, and keep the lower back healthy to prevent relapse. Home remedies for acute lower back pain. One of the biggest frustrations I experienced when I had lower back pain was the professionals I consulted with for treatment provided incomplete information. They did not give me the full picture in terms of what I needed to know and what I needed to do to recover as fast as possible and get my lower back condition to normal. As a result, it prolonged my treatment and recovery. In addition to the 4 tips previously mentioned to maximize professional help, the following are 5 home remedies, 5 things you can do at home to help with the recovery of lower back pain. 1. If you work at an office, if possible, get a standing desk and alternate sitting and standing every 30 minutes. One of the reasons people experience lower back pain is the glute spinal erector muscles become weak from sitting for long periods of time. When you stand, you naturally engage the muscles to support your lower back, which prevents them from becoming weak. 2. Use a lumbar support pillow while sitting or sleeping to support your lumbar spine. This is a good habit even if you don't have lower back pain, but it's even more important if you're recovering from lower back pain. Sleeping on your back or sitting for long periods of time overstretch the lower back spinal erectors. As a result, it compromises the structure of the lumbar spine and pelvis, which causes muscle strain and pain in the lower back. When you use a lumbar support while sitting or sleeping, it keeps the lumbar spine in a neutral position and prevents back pain. 3. If you have acute lower back pain, avoid compound exercises and any exercise that puts tension on your lower back. Some of the exercises to avoid include traditional deadlifts, back squats, clean and press, push press, military press, and any ab exercise that cause strain or pain in the lower back. You can resume these exercises when the lower back is healthy without acute pain. 4. Walk at least 30 minutes every day. Walking circulates blood and pumps nutrients into the back and glute muscles. Walking also helps stabilize the spine and strengthen the lower back muscles. Running and jogging is a high impact activity, so avoid running and jogging, especially if it causes pain in the lower back. On the other hand, walking is a low impact activity and does not cause pain in the lower back. 5. Strengthen your abs, spinal erectors, hip flexors, and glutes. Keep in mind, this should be done only after fixing subluxation. Certain ab exercises and lower back strengthening exercises can put more stress on your lumbar spine. You want to avoid this if you have acute lower back pain. The fastest and easiest way to correct restricted muscles and relieve lower back pain. In this part of the video, I'd like to discuss the best method to release the collective group of muscles we just discussed. This group of muscles include the spinal erectors, quadratus lumborum, QL, psoas, gluteus medius and minimus, and the inner hamstrings. There are 3 general options to release these muscles: massage therapy or other forms of manual therapy, vibrating massagers, and physical therapy, which includes stretching and mobility. Massage therapy. Massage therapy is effective for treating pain caused by injured muscles, such as lower back pain. However, it's necessary to get multiple massage treatments over an extended time, which can be expensive, making this solution impractical for most people. In addition, most people don't like the intense pain during a therapeutic deep tissue massage. Some people tense up during this type of treatment, which makes it counterproductive. Ultimately, the reason I do not recommend massage therapy and other forms of manual therapy is to fix chronic lower back pain as well as counteract and prevent lower back pain. It's necessary to treat the spinal erectors, glutes, hip flexors, and hamstring muscles often. So unless someone has the resources to see a manual therapist 2 to 3 times a week indefinitely, this solution is not sustainable. Vibrating massagers. When you apply vigorous vibration to a chronically stiff and tight muscle, it can trigger the muscle to tense up and get tighter. This is because the muscle is inelastic and cannot absorb the shock of the vibration. Most people find that their muscles get tense and tighter after using a vibrating massager. For this reason, I don't use vibrating massagers and do not recommend them when treating chronically tight muscles. Physical therapy. Stretching and mobility. Stretching will help lengthen a muscle and it helps reduce muscle pain and joint pain. However, stretching a chronically tight muscle will not lengthen the muscle and alleviate pain. Before you can lengthen the muscle, first it is necessary to release the restricted muscle. Then you can stretch the muscle to lengthen it and alleviate pain. So physical therapy, including stretching and mobility, are important, but they're not the solution. So What is the best method? Self-myofascial release tools. Self-myofascial release tools, aka SMR tools. The fastest and easiest way to release restricted muscles and fix lower back pain is to use myofascial release tools. Here are 4 reasons why I use and recommend them. 1. They are generally inexpensive, so cost is not an issue. 2. They are effective with trigger point therapy. Trigger points are specific areas in the body where muscle often becomes knotted and cause pain. I will show you how to easily identify those muscles, and because you know and can feel exactly where the pain is, you can easily target those trigger points yourself. 3. You can use these tools in the comfort of your home as many times as needed. Additionally, these tools are durable and last many years, so it's a sustainable solution. Finally, because you'll be performing the treatment yourself, you can control the pressure. As such, the body can remain relaxed throughout the treatment for faster and better results. Here's a quick summary. To fix and relieve lower back pain, we need to release restricted muscles in the lower back, glutes, hip flexors, and hamstrings. The 3 common treatment options are massage therapy, vibrating massagers, and physical therapy, which includes stretching and mobility. However, these options are ineffective or unsustainable. The best method and the fastest way to release restricted lower back muscles is to use self-myofascial release tools. Lower back pain SMR treatment video. I've created a simple to follow SMR treatment video for lower back pain. Myofascial release is a safe and effective technique that involves applying gentle, sustained pressure to a restricted muscle or trigger point to eliminate pain and restore motion. The lower back SMR video is a 5 to 10 minute treatment video where I show you step-by-step exercises to treat and fix lower back pain. You can use this treatment routine either at the gym or in the comfort of your home. You will need some SMR tools, specifically a body star massage ball, rumble roller, and PhysioRite. It's important to use the right tools to get results. If a person uses the wrong tools, the results are going to be frustrating and demoralizing. I've tested a lot of these tools to find the best and most effective ones. So if you don't already have these specific tools, make sure to grab them so you'll have them when you're ready to get started. You can find a link to these tools in the menu section of the members area or mobile app. Lower back pain treatment versus prevention. In this part of the video, I'd like to discuss the difference between treatment versus prevention for lower back pain. To treat and prevent lower back pain, we need to do 2 things. 1. Keep the spine healthy, and 2. Keep the lower back muscles pliable. First, let's discuss the muscles, then we'll talk about the spine. The treatment routine we will be using to release the muscles in the lower back is the same routine we will use to prevent lower back pain from coming back. The difference between treatment and prevention is how often we apply the routine. For example, to treat chronic lower back pain, we need to work on the lower back muscles every other day. 1 day treatment and the next day rest to allow the muscles to recover. For faster results, you can work on the lower back muscles 2 times a day, once in the morning and then once at night. You want to get to the point where the lower back muscles don't feel tender during treatment. Muscle tenderness is pain or discomfort when pressure is applied to the affected muscle. Once the tender feeling in the lumbar, spinal erector, glutes, hip flexors, and hamstrings is gone or significantly reduced, you have effectively released the restricted muscles causing pain in the lower back. From there, we want to maintain the new level of muscle elasticity to prevent these collective group of muscles from getting restricted again. For prevention, use the same routine in the treatment video 2 to 3 times a week to counteract and prevent lower back pain. Keep in mind, the more you train and the heavier you lift, the more you'll have to apply this routine to keep the lower back muscles pliable and healthy. Now, let's discuss spine health treatment versus prevention. As I mentioned earlier, if you experience sharp pain and it restricts your movement, the first thing to do is find a chiropractor to adjust and correct subluxation in the lumbar spine. To correct and fix acute subluxation, most people will need 2 to 3 chiropractic adjustments, but this depends on your specific situation. Your chiropractor can help you determine how often you need to get adjusted based on their assessments. For prevention, a good way to think about it is the body is always in a state of change. It's either anabolic or catabolic. Anabolic means it's improving and getting better. Catabolic means it's breaking down due to stress, pressure, and lifestyle factors. To keep the spine healthy and prevent lower back pain, it's important to have regular checkups with your chiropractor. I see my chiropractor once a month for routine spinal adjustments. In addition to applying the routine in the lower back treatment video, monthly checkups with your chiropractor will help counteract and prevent lower back pain. One final and important point to keep in mind: muscles support and stabilize the joints. When muscles become tight, the joints adapt to the tightness of the muscle to maintain pliability. Likewise, when muscles become more pliable and elastic, the joints must readjust to the new elasticity of the muscles. This means when you start applying the routine in the treatment video and the muscles in the lower back begin to release, the lumbar spine and pelvis will need to get used to the increased range of motion in the lower back, glutes, and hips. One way to help the lumbar spine adapt faster is to perform lower back mobility exercises. Mobility exercises improve range of motion, joint stability, and muscle strength by controlling the muscles around the joints. In addition to the lower back treatment video, I've created a simple to follow lower back mobility exercise video in a series called Power Strength Mobility. It's a 5 to 10 minute video. To summarize, you can use the SMR routine in the lower back treatment video every other day to treat and fix lower back pain. On the days where you're not using the treatment video, you can use the lower back power strength mobility video to strengthen and stabilize the lower back for faster recovery. When you get to the prevention phase where your lower back feels great and you can lift and work out without lower back pain, use the SMR routine 2 to 3 times a week to keep the lower back muscles pliable and healthy going forward. During the prevention phase, you can use the lower back SMR routine the night before any lower body workouts. It's also beneficial to use the lower back SMR routine after your lower body workouts, ideally 2 to 3 hours after the workouts. This practice will help the lower back recover faster for the next workout. We've covered a lot of information in this video. If any of this is new, some of it might sound confusing, like it was for me when I first started to learn some of this. If that's the case, I encourage you to go back and listen to this video or the audio program as many times as necessary. That way you'll have the foundational information necessary to fix and counteract lower back pain. Once I understood this information and implemented it into my fitness routine, it allowed me to eliminate and counteract lower back pain. I lift heavier on my squats, deadlifts, and clean and press. Additionally, my lower back recovers faster after working out. Getting started. To get started, check out the lower back treatment video in the TitaniumPhysique members dashboard or mobile app. Thanks, and I look forward to seeing you in the next video.